Tonight, we'll hear from Governor Tim Walz on the new restrictions being implemented across Minnesota in an effort to reduce the rise in COVID-19 cases. Plus, a political changeup, why two longtime DFL senators are taking a different route this legislative session. And with more people in need, a local food bank is looking for volunteers to help out this holiday season.
From CBS3 Duluth, this is the CBS3 News at 6.
Good evening, I'm Kristen Bakke. Thanks for joining us. Just minutes before he's expected to address the state, Minnesota Governor Tim Walz has outlined his latest COVID-19 restrictions. They include no indoor or outdoor dining at bars or restaurants, gyms must close, no wedding receptions, celebrations, or private parties. Indoor entertainment venues like casinos have to shut down, along with organized youth and adult sports. You should also note not gather, with anyone outside your household. This goes into effect at 11:59 Friday night and is expected to last until at least December 18th. Again, we're expecting to hear much more from Governor Walz on that during a live address starting momentarily. While we wait to hear from the governor, Wisconsin's Governor Tony Evers today also called on state Republicans to stop playing games and start saving lives. The Democratic governor says if the state continues on its current COVID trajectory, they could see 5,000 deaths by the end of the year. That's almost double the current number. Today, Evers announced he's extending the state's emergency declaration and the mask mandate through January. Republicans are challenging both in court. The governor called on them to drop the suits.
It's time, folks. We do not get any do-overs here. Enough games. We need you to join the cause, and we need you to start today.
Evers says federal CARES Act funding also runs out at the end of the year. He says so far, Wisconsin has spent $2 billion supporting people, communities, and business. Evers called on Congress to pass another round of relief. Well, before we hear from Governor Walz here, let's check in with Dave for a look at the weather.
Well, it sure was a warm one today, Kristen. A warm front came through as promised and sent temperatures up as expected. Here's a look at the almanac for today. Duluth's high temp, for example, made it to 41, 7 degrees warmer than the normal of 34. Still not warm enough to set a fresh record, so the old one of 64 from way back in 1904 still stands. Well, what's standing right now out there? We're looking at that warm front to continue keeping us on the milder side here through Thursday. Tomorrow may be even warmer in some towns, could crack 50 degrees. But as early as Friday, that cold front to the west comes to call, takes our temperatures down a little bit, and brings us a very slight chance for some flurries. But the Thursday day planner says it should be on the dry side with a partly sunny to mostly cloudy sky. We start the day warmer than normal at 32, finish the day warmer than normal at 45 here at the head of the lakes in the Twin Ports, but at least one or two places could crack 50. I'll tell you who that's going to be in a few more minutes.
Thanks, Dave. Two longtime Minnesota DFL senators from the Iron Range are breaking away from their party. Senators Tom Bach and David Tomassoni announced today they're forming an independent caucus. Senator Tomassoni and Bach said they are both extremely tired of partisanship within the Minnesota Senate. They added forming the new caucus is just a progression of aligning more with moderates rather than the far right or left. Bach says the DFL party has not been aligning with some of those ideals, such as mining.
We're not becoming Republicans. We've been very clear with Senator Gazelka about that. We want to be independent. We will cast votes that Democrats, I think, don't like. We'll cast votes that Republicans don't like. But based on our experience, we're going to try to do what's best for the state and for our districts.
Bach and Tomassoni said they do not plan on identifying with the independent party. Coming up later tonight at 10 o'clock, we hear from a DFL senator and her thoughts on the new caucus that has been formed. Minnesota's GOP party applauded the two state senators for what they called abandoning the DFL. In a statement, GOP party chairwoman Jennifer Carnahan called the DFL a, quote, metro-centric party. She claims Minnesota Democrats dismiss people who live outside the metro, and now they're paying the price. President Donald Trump's campaign paid $3 million for a recount in two Wisconsin counties. Those counties are Milwaukee and Dane, two heavily Democratic areas. Trump's campaign says those counties were the site of the, quote, worst irregularities, although no evidence of wrongdoing has been presented. The recounts will start no later than Saturday. In those counties, Democrat Joe Biden received about 577,000 votes compared to the 213,000 for Trump. Local food banks have seen an increased need since the start of the pandemic, and they're expecting that number to grow into the winter. Second Harvest Northern Lakes Food Bank, serving the Northland, has seen an increase of 10% since August. With new restrictions and winter months ahead, they anticipate more families will need help putting food on the table. Executive Director Shay Morris says they need volunteers and donations to continue providing support to families in the 8 counties they serve.
We're expecting that to continue well into the winter months. It's a little scary to think what that's going to look like. So the holiday seasons are certainly a time we would love people to support our work, because that is definitely going to carry us into spring.
Morris says part of why many families are needing extra help is due to stimulus checks not being distributed and extra CARES Act funding ending. For more information on how to donate, you can head to our website. A new long-term COVID-19 testing option opens on the Iron Range today. You can stop by the Hibbings National Guard Armory for a nasal test. It's open from noon to 6. You don't have to have symptoms or insurance. You are encouraged to register beforehand. We have a link for that on our website. The days of operation are different each week. We've posted their schedule on our website as well. With the holidays almost here, a new gift drive in Hibbing is hoping to support a number of Iron Range families. In the next few weeks, the city's police and fire departments will collect and distribute items for their first ever public safety Christmas drive. Public safety leaders are asking residents to donate new and unwrapped gifts, unused clothing, or money. Hibbing's police chief Steve Esty wants this event to bring warmth and hopes to those he serves. Well, as we promised, Minnesota's Governor Tim Walz is addressing the state of Minnesota right now as he implements new restrictions as cases of the coronavirus continue to rise. We're going to listen in for a few minutes to hear what Governor Walz has to say.
Long-term care providers of folks who need a little extra help. All of you have been put on the front lines, putting yourself at risk while you do the work that absolutely has to be done. And to the countless students who've lost opportunities to do the things that seemed so easy 9 months ago. We know this has been difficult and it's been challenging, and much has been asked of you. And I need to ask a little more. We're at a point in this pandemic that the decisions that we make now will have huge repercussions on the health, well-being of our neighbors, of our healthcare providers, of our daycare providers, of our teachers, and so many of our neighbors. We're at a dangerous point in this pandemic. As many of you have seen, it is raging across the upper Midwest and across this nation. We're seeing infection rates in the states surrounding Minnesota that are the highest on the planet. Just 2 weeks ago, the states to our west were 1 and 2, the states to our south and east were 3 and 4. We were 21st in infection rates per capita. That's all changed. We now know that more than a third of the folks who are getting infected are coming from sources they don't know. That's very, very dangerous, because if we can't test and if we can't isolate, the spread exponentially grows. And COVID-19 is already overwhelming our businesses, overwhelming our schools, and of course, the congregate care facilities and our medical institutions. That's the situation where we're at. Now, in the 8 months since we've been dealing with COVID, we've learned much. But we also know, and much of this is predictable, on how we act and how this virus moves will have huge implications on the number of people who will be hospitalized and ultimately those who will lose their lives. So here's what's happening as it's surging again. This is a day and at a point in this pandemic that we hoped would never happen, but we prepared for it. But I think, Minnesotans, you need to understand just how rapidly this is happening and how rapidly what even has become the new normal is no longer sustainable. It took us, as you look, 29 weeks to get the first 100,000 cases. It took only the next 6 weeks to get to 200,000 cases, and it's going to take less than 3 weeks to get 300,000. That will continue to accelerate to 400,000 and 500,000. The reason it matters, if you look at this from the beginning, is the curve and the infection rate is exponentially going off the chart. And I want to note, Minnesotans, what was asked of you. If you look at this chart, from March until September, we were one of the few states in the nation that achieved what you were able to do. We did bend the curve. we did keep the spread flat, and we did protect and save lives. But as the infections came back, and as the hot spots moved to the upper Midwest, we were no longer able to keep that out. And over just the last several weeks, we went from being in a situation where we could contain and our hospitals were not overwhelmed and we were not seeing the community spread rate to the situation you're looking at now. And just in the last 2.5 weeks, as we've been talking about, the ground is literally shifting under our feet. These are, what you're looking at here, is the 7-day case growth rate, and it was about 10%. That was high but manageable. That's gone to 75%, and it will go off the top of this chart over the next 7 days. The thing when you get the data, and we're looking at the data, is that there's a lag period that goes with this. What we see is when people are infected, we see infection rates obviously go up. What follows that, almost with certainty, at about a 2-week to 3-week time period is increased hospitalizations. And then almost like clockwork, following those hospitalizations are ICU admittance and deaths. And so if that pattern holds true and we had 100 cases, we could expect to be able to understand the 1 or 2 people we would see in the hospital. And then we would see the numbers that would die. So when some people say, well, the vast majority of folks recover, that's true. What we don't know is the long-lasting effects it'll have on them. But even so, at the spread we're seeing now, it's not 100 cases. It is approaching 10,000 cases a day, which means it's not 1 or 2 in the hospital. It's 1,000 or 2,000. And the charts you're looking at here of what's happening, beds across our entire hospital system. And I want to just at this point pause to thank our hospital systems, thank the administrators in their hospital systems, and a special thank you to those frontline healthcare workers, because they are the ones that have to be there day in and day out, not just for COVID. If you take a look what we're seeing, take Northeast Minnesota, 95 beds in use. Normally, those are beds for folks who might have had a broken arm, they might have gallbladder surgery, unfortunately they might be having cancer treatment or doing something that was there, an emergency, a car accident. Those are the beds that are filled. There's only 7 of those available. COVID-19 is now filling 1/3 of those beds. In some places, half of them. And if you look with 7 critical care beds available and the case growth rate we're seeing, you can extrapolate that we will run out of that space. And it's not just the metro, as you're looking, it's across the system. Now, we have made preparations to make sure that we can cross-level, that we can move beds should we need and move people should we need to. But part of this and part of what you're seeing on this, and you're going to, as we talk about mitigation efforts, it's not just the beds, it's not just the PPE, it's not just the supplemental oxygen or some of the therapeutics like remdesivir that make a difference. Somebody has to administer those. Somebody has to be there. And they are getting sick, they being the healthcare providers, at incredible rates. And they're not getting sick at their hospitals. They're getting sick in their communities and community spread. So here's why it matters. Those frontline workers are dropping out of their workforce. Either they have been exposed, they are sick, or a family member is sick. We have thousands of healthcare workers that need to be there at this time when people are needing that care, that they themselves can't deliver that. Hospital beds might be open, but we need to make sure we have the providers to give the care. Too many long-term care and nursing home staff are unable to care for those that they rely on. Nursing homes across this country, because of the underlying health conditions and age, has impacted our most vulnerable. And while we see that those numbers are up, the healthcare workers are not getting it in the facilities. They're getting it in the community, by community spread. Either they stopped at a friend's house after work to watch a football game, or they went and spent time in a restaurant, or they were close to someone for too long a period of time. That's where they're getting it, and then they're taking it in. And here's the situation in long-term care. In some cases, we have the entire staff that might not be able to go to work. These are people that need, in some cases, round-the-clock care. Now, in the state of Minnesota, we've been able to provide surge teams to be able to care for that. We've activated over 400 Minnesota National Guard and are training them to be able to go in as triage teams when a facility calls in one morning and says, we've got nobody that can go into the facility to do the basic care, the feeding and the bathing and the basic care of our parents. And we're seeing now fire departments, police departments are being hit incredibly hard. In some cases, they don't have the capacity now to be able to respond to basic community safety issues. A fire, something where someone needs police officer to respond, they don't have the staff to be there. That's what this surge means. That's what uncontrolled community spread means, and that's the situation that we're in. And again, we've done much to prepare. We've done much to prepare for PPE. We've done and have surge bed capacity. But the one thing that we have got to preserve is we have got to preserve those care providers, and that's by the behaviors that we exhibit. All of this comes back down to families and to each and every one of you. And I just want to be very clear. The teachers and the caregivers, the folks that are there, that are doing everything they can to make sure in childcare or to get our kids back where they need to be in-person learning, those schools no longer can stay open because the teachers are getting it in the community, not at their schools and not at their daycares, but in the community, and that's shutting them down. That puts a pressure on the families, whether they're a care provider or not. Now all of a sudden, how do they go to work if there's no place for their child to be? And so we have got to prioritize our children and our families and those things that matter, schools that matter to us. So here's what we've asked all along as we've tried to understand COVID. Who's most at risk and who can get it? When are they getting it and where are they getting it? And through the last 8 months, we've taken measures. From early on, we did a stay-at-home order because we knew we were not ready in our hospital systems. We knew we were not ready to care for folks if they needed that bed. And we knew we did not have testing and we did not have personal protective equipment. We used the time that you bought us to build that up. We have those things. We have the capacity to be able to do that. What we know now, with the massive amount of spread we're seeing throughout the upper Midwest, is all of us are at risk. And while it might not be a risk to your personal health, you may even be asymptomatic, which a large percentage of our 18 to 35-year-olds are, but they are giving it to others. And that other may be a teacher, a long-term care provider, someone with an underlying health condition. When are people getting this? All the time now. It is in everywhere. Most people, because of the amount of interaction we're doing and because of the amount of the virus spread, it's very difficult for us to even contact trace a lot of places where and who people are talking to. So the focus needs to be for us is, where do we know we can make an impact? Where can we slow the spread of the virus again to not overwhelm those systems? And where can we make that impact with the most targeted approach to make sure what we know all along? This is incredibly hard. And there are peripheral repercussions of everything that we do, whether it be economic, mental health, physical health of people. There's a trade-off in what we do. So here's what we know about risk now and what we know about COVID-19. The longer you're around someone or in a place to possibly find the aerosols in the air, the greater your chance. And as I'm always reminded by my healthcare professionals, it's almost virtually impossible to reduce the chance to zero, but you can make things less risky, and that's what we figured out. We also know now that indoors is far more risky than outdoors. We started to understand that early, but once we saw when folks in the South started moving in the heat in the summer and their numbers went up in Arizona and Florida, and they started going down in the winter, we started to see ours go up as we moved back in during cold weather. And what we absolutely know, and this is not debatable, it is not one person says and the other. The scientific data and the information we have is pretty clear. Masks do help. They help mitigate the risk. They help mitigate the risk for others that you're around, and there's even some new data that cloth masks do provide some protection for yourself. And what we know is the closer you're together and going back for that longer period of time, your chance of getting it is much greater. So as you're thinking about this, Minnesotans, think of those activities where you're close together for long periods of time and not wearing a mask, those are the riskiest places. And what's really hard about this is it's some of the places that are most important to us, namely being your home. To invite a friend over or a brother-in-law like I normally do to watch the Vikings play the Bears is one of the riskiest things we can do right now. It seems so easy, and it doesn't seem like that would be a big deal, but that's a risk. And that would be the same with a bar, even a little bit more. If it's a little bit noisier and you've got to cheer a little louder to be heard, that puts the aerosols into the air and increases the risk. So we've got to use our knowledge to reduce this. There are issues that we know, and in the early parts of the pandemic, we didn't know this. So we closed down personal care providers, getting your hair cut. What we know now is wearing a mask, proper protective equipment for the folks that are working there, a limited amount of time in there, and a pretty predictable activity you're doing, we see very low risk in the spread. Same thing with shopping and retail. If you make it quick, you don't congregate together, you use social distancing, you wear a mask. But once again, social situations, seated, unmasked, groups of folks that are not in your family, all of those things have led to not one big super spreader event, but thousands of micro spreader events that have got us in a situation where our healthcare systems are potentially could be overrun. So here's what we need to do. We need to take a pause, and we use dials, and we've saved lives, and you've asked and been sacrificed. And just to be clear, no one thinks that this is easy, and no one thinks that this is fair in how it's hitting. This virus is not fair. This virus disproportionately hits people of color. Our black communities are twice as likely to get sick and be in the hospital. And no one thinks it's fair in the businesses that it hurts. Our hospitality industry is predicated on creating wonderful atmospheres where we're close together, sharing exciting times for long periods of time. That's not fair that the virus makes that the place where it spreads, but it's a reality. We've done this, Minnesota. We've done it before. It wasn't easy. It was incredibly hard. In the spring, you were asked and you responded. And just to be very clear, for those that want to know if it makes any difference, it made all the difference in the world to quite literally hundreds, if not thousands of Minnesotans who did not get sick and did not die because of the decisions that you made, that you chose to do to protect them. So our frontline workers are now getting the PPE that they need. It's still a bit of a challenge, but we've gotten so much better at it, and it's there. Our hospitals have been able to understand and manage their demand and create surge capacity. We can double and almost triple our capacity in 24, 48, and 72 hours if we can keep our workers in place. And Minnesota is now a national leader in testing. We brought the testing lab to Minnesota. We've expanded it. At one point early in May, I promised you I would get us to 5,000 tests, and I was asked, who's responsible if we don't? And I said, me. We are now have the capacity to test 75,000, and we're regularly testing over 50,000 people a day. The reason this is important is it lets you make an informed decision to not infect others. It lets you understand where you're at and to self-quarantine to break this spread. So the virus did stay under control. And national folks were wondering, why did Minnesota stay at about 5%? We didn't drop below it, which I sure wish we would have, but we stayed at about 5%. And the fact of the matter is, when we look at mobility data, some of the mask wearing and the mitigation, many of you did what needed to be done. But it's here now. As I said, we were 21st while our neighbors were 1, 2, 3, and 4 in infection rates. We've now moved into the top 10. So we are at a critical point, and it's time for us to do it again. So this pause is what we're going to ask you to do. It's going to start at this Friday at 11:59, and it's social gatherings with other households. Don't bring other households in. Don't bring, and this is, I have a big family. We do a lot of things together. That's not going to be possible. It's immediate family. We're going to stop in-person dining. But I want to be clear, and I'll stress this a little more later, order out. Make sure we're spending money locally in these businesses. Make sure we get there. But by setting inside right now with the amount of community spread we have, we're not going to get a handle on this unless we take a pause on it. The next ones are tough: fitness centers and adult and youth sports. And I want to speak to those folks out there because it's a passionate group of people around youth sports, and I feel like I'm right in the center of that. Those of you who've heard me say this, my life is about coaching and being around it for decades. I've got a 14-year-old whose greatest excitement of 2020 was he made his team, and he was going to be on a team with some others to be able to play here during the winter sports. And now he's not going to be able to do that for a few weeks. So I understand it's not easy and it's not fair, but it's a sacrifice that we need to make. If we don't do that and we continue this spread, we will with absolute certainty put our hospitals at risk and those that need the care as well as the care providers. Places like bowling alleys and bingo halls and theaters will need to take a pause. Receptions, private parties, and other celebrations, the same thing, and outdoor events and entertainment. Things where we gather in large numbers, even outdoors if we're going to do it. Now, with that being said, we've learned much. We know ways to control this, and we know what doesn't pose as high a risk, but gives us both economic, physical, and mental well-being if we participate in those activities. So here's some of those things. Schools are still following our safe learning plan. It's working. We know we're dialing back. My son's in distance learning. I trust the superintendent and I trust the decision makers in the St. Paul Public Schools, just like many of you do across this state. Where it makes sense, we need to have those kids in the classroom, but they can't be there if their teachers are sick because we have community spread. So we need to stay in that distant learning place, or a hybrid model, or when we get a handle on this, back in that classroom. Child care providers will remain open. When this is all said and done, and the stories of this 100-year pandemic are written, there will be heroic stories written about child care providers who did everything they could to make sure that first responders, made sure that frontline workers, and made sure so many of us had a place of safety, well-being, and growth in the middle of the pandemic with child care providers. You can go get groceries, you can shop for the holidays, and you can get takeout for supper, which I certainly encourage you to do if you can. Places of worship are not impacted. I want to tell you, I spent the afternoon calling our faith leaders, and they know it's the job that they do to administer to the spiritual, the physical, and the mental well-being of their parishioners. What they understand is that basic freedom to be able to worship. They understand, and we understand how important that is. But they also understand and are sending the message that taking care of our neighbor and keeping our neighbors safe is the highest calling in any of our major faiths. We understand that treating our neighbor with that respect is at the center of most of our most cherished beliefs in our religions. You can still go get a haircut if you need one, and we encourage you. You can go outside. When it was golf and we figured out, or it was running outside, or it was boating,
CBS3
cross-country skiing, or walking in the woods, encourage you to do that, but don't do it with other families, and don't do it close together. We encourage you to wear masks, social distance at all times. So Minnesota, I'm asking you to do something that should never have been asked of you again. And I want to acknowledge very, very clearly what's being asked is hard work. To those small business owners, we need our federal partners to step up and provide the relief necessary. You are doing a public service beyond anything that should be ever asked of you. By closing your doors and putting your financial well-being at risk, you are protecting the lives of your neighbors. In this country, and so many across the world did it, and we need to do it again, we need to have a stimulus that provides those small business owners, especially in the hospitality industry, the help they need. And to the workers who are out there who are worried about paying your rent and moratoriums on this, we need the United States Congress and the current administration and the incoming administration to work together to come up with a plan to help us on this. This is unanimously agreed on with no partisanship whatsoever amongst this nation's 50 governors. We have sent letters together. We have appealed to them and asked. So I can tell you, I will continue to fight for that both here at the state level and at the federal level to make sure it gets done. And it's not going to be easy. These numbers are hard. And as I already told you, this lags. What is so heartbreaking about this is I know that hospitalizations are going to continue to go up for the next few weeks, and I know that the death numbers will continue to go up for the next few weeks. But the bright spot of this is the moves we take now will start to bend that at just the time when the potential for a vaccine is coming. That's what's different, Minnesota, this time. I heard a nurse the other day was with me, and she said, please stay home over Thanksgiving so you're not celebrating New Year's with me in the emergency room. And I was up in Moorhead with a firefighter and said, you know, Governor, I really didn't think this was this serious. I followed the rules. I had a little gathering in my garage, and now I'm a long hauler, and I can't get over this and can't go back to firefighting. The other day, I was going to have a young family with me to talk about their 13-year-old son's fight with COVID. On that very day, he was readmitted back to the hospital. These are challenging. And for those of you that are worried financially, I hear you. I hear you. This is incredibly painful. It's incredibly challenging. But there is that news. This is different than the spring. We have better therapeutics. We are better prepared for it. We have the capacity, if we help our hospital systems not be overwhelmed, to make sure everybody gets that care and reduces the death rates. And we had something that was hard to even imagine back in March. We've got a light at the end of the tunnel. I believe with every fiber of my being that there is an incredibly strong possibility, more like a probability, that we will be vaccinating people before the end of this 4-week pause in our long-term care facilities and our frontline healthcare providers. And Minnesota is ready to go through and roll out that vaccine plan to the rest of us. We can do this, Minnesota. We can get this right. We can save lives. And this time, the end side of this is, by the time those trees are budding out again and by the time the Twins bats are cracking, we've whipped this thing. The idea of sitting in that stadium on a warm April day and watching the Twins play while you eat a hot dog and talk to your brother-in-law and your next-door neighbor who are decked out and talking maybe without a mask, the ability to be able to do that lies within us. If we don't get this right, it drags on. If we don't get it right, there's going to be Minnesotans like the 3,000 plus already who won't enjoy that Twins game. So we've got the chance. What's always pulled us through this is our grit, our sense of community, and our belief that it matters what we do can positively impact our neighbors. So I'm asking you one more time, Minnesota, let's pause some of the social stuff. Let's be smart. Let's mask up. Let's get through these next few weeks, and let's get to the point again where we can celebrate the things that we really care about. Thank you, Minnesota.
That is Governor Tim Walz announcing a new 4-week dial back to control the spread of COVID-19. The new guidance pauses in-person social gatherings, dining, sports, and fitness centers, but retail, shops, salons, places of worship, and other activities may continue to operate under current restrictions. We have a full breakdown of the new restrictions on our website. And tonight at 10, we'll hear local reaction from business owners. We'll see you then.